Buying a supplement is somewhat like buying a pig in a poke. Within the capsule or tablet we have purchased, we may not have the proposed amount of the active substance, we may have more or less, and sometimes to quite a significant degree. We may not have the proposed active substance at all. This is something that sounds really cool on the advert and potentially mechanistically effective, but still more like a gimmick. It's worth noting that Perfectil doesn't promise to improve our skin, hair and nail condition, they only suggest they will support it. The only practical solution here is for each of us to have a robust framework that we can apply to decide if any given supplement is worth buying and taking or not. In my practice, I see that supplements are quite a popular topic, and working with clients, it's obvious that this is something they're really readily buying into. And part of the reason is that financial investment and compliance aspects aside, that is, paying for our supplement and making sure we take them timely, there's not much other effort required by this intervention from us. And at the same time, it promises us health and potentially lifespan benefits. But we need to be aware that the supplement industry is plagued by two vices that make this initially very attractive concept somewhat equivocal. The first problem with supplement industry is quality control, because it's not regulated the same way as the pharma industry. And because of that reason, buying a supplement is somewhat like buying a pig in a poke. Within the capsule or tablet we have purchased, we may not have the proposed amount of the active substance, we may have more or less, and sometimes to quite a significant degree. We may not have the proposed active substance at all. Moreover, instead of the active substance, we may have either a neutral substance without any beneficial effects, so that's a waste of money. We may have a completely different substance with different effects, and sometimes these effects may even be harmful. So it's tricky, and the only practical solution for this is buying from reputable brands and betting, or rather having fingers crossed, for their internal quality control mechanisms. The second problem is hype. There's an avalanche of different marketing offers spiced with alleged efficiency proofs that we are all subjected to on a daily basis, either via social media or conversations with colleagues and friends and so on, and it's very difficult to choose from. And the only practical solution here is for each of us to have a robust framework that we can apply to decide if any given supplement is worth buying and taking or not. I'm Dmitry Sokolov, International Board Certified Lifestyle Medicine Physician, and after this video you will have full clarity on how to choose your supplements right. The framework I'm talking about is quite simple, and we can pack it in just 3 words: goal, effect, and risk. And during this video we shall expand on each of them and bring in some supplement examples to get the full picture. When thinking about the goal of taking a specific supplement, we need to clearly understand if we're trying to sort out the existing problem that we've already got, or we're trying to prevent a potential problem. For someone who has microcytic anemia due to B12 vitamin deficiency, supplementing B12 would be sorting out the existing problem. For another person who doesn't have such an issue, taking a multivitamin supplement out with concern that their nutrition is somewhat suboptimal would be an attempt to prevent a potential problem. The next question in the goal domain is, am I trying to correct the deficiency, or am I trying to achieve supraphysiological level of a said substance? If we look at vitamin D or omega-3, then we'll see that most individuals, unless they are already supplementing or having some remarkable lifestyle and diet, are going to be deficient below the levels that are associated with the best health outcomes. So supplementing vitamin D and omega-3 fatty acids, we're aiming correcting existing deficiency towards the optimal levels and maintaining such optimal levels long term. Conversely, if we think about creatine supplementation, in this case, we're aiming supraphysiological levels that are proven to be beneficial for our physical and cognitive performance. If we think about our body's creatine stores, most of it are in the skeletal muscle, it's about 95%. And about 5% is stored in brain, heart, and other tissues. And in order to fill these stores, creatine is both produced by our body, mainly in liver and kidneys, and this production totals somewhat about 1 gram per day. and it is also consumed with food. And the foods that contain creatine are muscle, basically, red meat, fish, and poultry. And consuming it with food may add 1 or 2 grams per day. There's virtually no creatine in dairy products, and there's none of it in plant foods. So if you're vegetarian or vegan, your body is only going to be relying on the synthesis of creatine, which, as we've noted, is around 1 gram per day. Does that make you deficient? No. You will simply have lower body creatine stores, and you can live with that, no problem at all. And if you're an omnivore, depending on the consumption, like how much of that creatine-rich food you get every day, you may be getting additional couple of grams a day. But if we want to tap into the enhanced performance effects of creatine, we need much more than is normally achievable for both omnivores and non-omnivores. We need about 5 grams per day long-term for enhanced physical performance, and in the realms of 20 grams a day for enhanced cognition effects. So we can see that with creatine, we're not aiming correcting a deficiency, but we know that it is the supraphysiological levels that are linked with enhanced performance, and that is why we are supplementing. Another question in relation to the goal is, are we trying to improve our health, or are we trying to enhance our performance? For example, if you supplement caffeine before your workout, not in the form of beverage that may contain other healthful ingredients like polyphenols, but in the form of caffeine supplement, including pre-workout, then yes, you will be getting some performance benefits in relation to your workout, but it's unlikely that you're going to be getting any health benefits with that. Conversely, if we think about the before mentioned creatine supplementation, it not only results in enhanced performance, both physical and cognitive, but also in health benefits, because there's emerging research about neuroprotection, benefits for traumatic brain injury, for Parkinson's disease, as well as workout injury prevention and enhanced recovery after workout. So whenever we want to boost our performance, we need to evaluate health implication. Are they positive, net zero, or negative? Now, let's look at the important points that we need to assess with regards to the effect of the supplement that we are considering using. And such will be 4. Firstly, is this supplement effective for a given goal? Do we know and do we understand the exact mechanism of how it works for a specific purpose? And is this mechanism well studied in robustly designed studies? Secondly, and the effect of the given supplement or absence thereof will be very dependent on that, is the active ingredient present in the effective dose in the particular formulation that we're looking to buy. And here, let's look at the example of Perfectil plus extra hair support supplement. Sounds really fancy, which specifically emphasizes presence of collagen and coenzyme Q10 in its formula. At the very top of its nutritional information, we see marine collagen, which indicates average 200 milligrams per 2 tablets, so 100 milligrams per tablet. However, if we look at the evidence base with regards to marine collagen supplementation and hair health, we will see that of the very few studies actually tapping into this in humans, the USR 2020 study showed the effectiveness of 2.5 grams per day, whereas the 2024 study by Riley and Associates was evaluating 8 grams per day. So based on the available data, 2.5 grams per day is the minimum dose that has proven clinical effectiveness for this specific purpose. And this is 12.5 times higher than whatever is packed into 2 tablets of Perfectil. Another ingredient of this supplement is coenzyme Q10. And although it could be beneficial for hair, there is no robust clinical evidence from oral supplementation studies to support this or to establish a minimally effective dose, because most of the positive effect evidence we have comes from topical application, where it directly stimulates keratin production and provides antioxidant protection to the hair follicles. So again, this is something that sounds really cool on the advert and potentially mechanistically effective, but still more like a gimmick if you look into the detail. It's worth noting that Perfectil doesn't promise to improve our skin, hair, and nail condition. They only suggest they will support it. On this note, I would like to generally advise against multi-component supplements. And I'd rather suggest you purposefully supplement with products with one or very few ingredients, considering all of them are present in adequate dosages. Firstly, because multi-component supplement ingredients are quite often present in sub-effective doses, as we could see with the Perfectil example. And the second reason is usually these multi-component supplements are packed with vitamins and minerals, which you may either be receiving in adequate quantities with food already, rendering them unnecessary, or you may be already supplementing them in other ways, which in turn may put you at risk of overdosing and potential adverse effects. So it's best to stick to one or very few ingredient supplements to have a more guided approach to supplementation. The third question in the effect domain relates to the correct way of taking a specific supplement. Should it be taken on an empty stomach, or should it be taken with food, particularly with fatty food like fat-soluble vitamin D or curcumin? And what else can improve or worsen its bioavailability? For example, taking iron supplements along with vitamin C would boost its bioavailability, but taking it with coffee or tea would significantly worsen that. So these seemingly small nuances may play an important role in the resultant effect of supplementation, particularly if we're talking long term. I remember a patient who was taking 4,000 units vitamin D religiously every day, but had vitamin D levels of only 18 nanomoles per liter. That was prominent deficiency. And when I asked him, how do you actually take this supplement? He said that he was taking that every morning on an empty stomach with water. And naturally, with vitamin D being a fat-soluble vitamin, its absorption in the absence of fat was negligible, and the patient was resultantly stuck with deficient levels despite taking seemingly adequate dose. The fourth question in the effect domain is probably the most practically important, as this question directly relates to the outcomes. How can we evaluate the effect of supplementation? Is there a biomarker for that, like a blood test, or are there any performance metrics to allow us to monitor the effect? For example, with omega-3 supplementation, we should be checking omega-3 index in blood, which is the value that shows the percentage of EPA and DHA among the other fatty acids that form the membrane of red blood cell. And we should be aiming 8% or more for the best results. If we are talking iron supplementation, we would be looking at ferritin levels and full blood count responses. With vitamin D, we can check 25-hydroxy vitamin D levels in the serum. It's not ideal, but it's a good marker, and we can gauge our supplementation towards 50 to 80 nanomoles per liter. Same goes for supplementing B group vitamins and other minerals. We can just check the blood levels, so we have the biomarker. If there is no direct blood test, then we have to look for alternative metrics. For example, with creatine supplementation, yes, we can perform a muscle biopsy, which is the direct and invasive method where we can just take a sample of muscle tissue and analyze its creatine stores. We can also use MRS, magnetic resonance spectroscopy, which can detect and quantify levels of creatine and phosphocreatine in muscle and also in brain non-invasively. But these methods are not practical for individuals or even small clinics, and they are reserved for clinical research. What we can do as individuals or in the clinic setting, we can test our physical and cognitive performance before starting creatine supplementation and then retest it about 4 to 6 weeks into it when our creatine stores are saturated. In terms of physical performance, we can assess strength gains with 1 rep max or quantifying reps to failure with about 80% 1 rep max. We can also evaluate power output or sprint performance. For example, we can do a 10-second bike sprint and see how much watts we can put out. Or we can do a 40-meter dash and see if there's any improvement in the time, like decrease in time for 40-meter dash. And also we can evaluate changes in the body composition, ideally with DEXA, where we expect to see increase in lean mass. So evaluation of the effect is critically important. And regardless if it is the blood test, like the biomarker we're using, or performance metrics, we should first evaluate the baseline before supplementation, then we decide if such supplementation is actually necessary, and then if we embark on it, we should be regularly retesting either the blood biomarkers or the performance metrics to monitor and guide supplementation. And so we arrive at the third and last domain of our supplement assessment framework, which is risk. So the questions here we must ask are as follows. Are there any risks of short-term supplementation? Are there any risk of long-term supplementation? Because these may differ. Are there any blood levels or doses of the supplement which are more closely associated with risks? Will this supplement interact with any other supplements or medications I am taking? Or do I fall into the group which is more likely to experience the risks with this supplement? For example, we know that vitamin D is safe unless we approach the doses that are associated with toxicity. So if with our supplementation we're achieving levels of 50 to 80 nanomoles per liter, then we're doing well in terms of achieving our biomarker goals and potentially getting the best outcomes without any adverse effects. However, if we exceed 125, or even more so, we exceed 150 nanomoles per liter, then we're heading into the toxicity territory, which may lead to hypercalcemia and all the other deleterious effects associated with that. Another example is omega-3 supplementation. We know that the doses in excess of 5 grams per day may be linked with higher incidence of adverse effects, such as atrial fibrillation and clotting dysfunction. If you're a patient with hemochromatosis, beware of multivitamin supplements. They may contain iron and vitamin C. And as already mentioned, vitamin C notably increases iron absorption, and with both these present in one supplement, you run into a much higher risk of iron overload. So for you, it's best to supplement with individual vitamins and minerals, not the multi-component versions. So the risk topic is quite vast, and it needs rigorous attention before we embark on any supplementation. In conclusion, I'd like to say that it's best to approach supplementation on an individual basis, following a thorough review of medical, drug, and family history, and taking into account all the specifics of your physiology and potential drug interactions, and guided not just by social media adverts, AI advice, or word of mouth, but rather evidence-based advice of a medical professional. At the same time, I'm confident that the goal-effect-risk framework we have discussed today will help you reflect on the supplements you're already taking and scrutinize the ones you're planning to take in future to minimize adverse effects, unnecessary spending, and max out your health and performance benefits.